Hey Siri, what is CLL?
I found 10,300,000 results for what is CLL.
Oh, where do I begin?
Hi, we heard that you had some questions about chronic lymphocytic leukemia. My colleagues and I on the line actually all specialize in CLL, and we'd love to help you navigate this journey and answer any of the questions that you have.
I feel so overwhelmed. There's so much information out there about what CLL is, and I want someone to explain it.
Chronic lymphocytic leukemia is a blood cancer, and specifically, it's a cancer of lymphocytes. When we talk about blood counts, we often talk about them as if it's one thing, but in fact, blood counts are multiple different types of cells. There's neutrophils, there's lymphocytes, monocytes, eosinophils, basophils, and even within the lymphocytes, there's T cells and B cells, so it can get complicated very quickly. But chronic lymphocytic leukemia is specifically a cancer of B lymphocytes.
Interesting. So how common is this? And are other people my age at risk?
About 21,000 people every year would be diagnosed with CLL in the US. The median age for diagnosis of CLL is about 70 years old, but the range is wide. So younger people can also get CLL.
I've seen patients as early as their 20s, and of course, all the way into much older individuals.
And what exactly causes CLL?
So when a patient asks me, how did I get this? My fundamental answer is we don't know. We have some insight into it, but I don't think that there's currently any evidence that there's things you can do differently to avoid it, or things that may reduce your risk of acquiring the disease in the first place.
Wow. Okay. So if I don't know what causes it, how would I know if I even have CLL?
This is a very good question. CLL can be diagnosed in many ways. It could be diagnosed often during a routine visit to your family practitioner or your primary care physician, who may notice a slight increase in the white blood cell count and order a differential on the white blood cell count and notice that there's a slight increase in the lymphocyte count. And if this persists, they may lead to further investigations, which can lead to the diagnosis of CLL. And then, so this is the rather an asymptomatic way to diagnose CLL, where it's picked up by chance.
What we also look for in blood is we do something called a complete metabolic panel. This is not so much related to lymphoma as it is just the general health of your organs and the rest of your body. So this looks at things like your liver function, your kidney function, and your electrolytes. The last thing that we typically do from a blood test for CLL is something called an LDH. Now, an LDH is a non-specific marker of cell turnover. So what this means is CLL is typically a cancer that is slow growing or more indolent, as we call it. When we see an elevated LDH, that gives us a clue that something's growing a little bit faster than it should be.
Does an increase in blood cell count necessarily mean that I have CLL? What are some other signs?
It's not uncommon at all for a routine blood test to show some abnormalities. In chronic lymphocytic leukemia, if people have a set of blood counts, oftentimes that the disease really stands out, and so a patient might be referred to me for abnormal blood counts, and that probably represents a sizable fraction of the patients that I see. Other patients may notice enlarged lymph nodes and maybe a lump in their neck or a lump in their groin lymph nodes.
There are a majority of patients that do develop symptoms with their CLL as it progresses. So that kind of runs a gamut. We typically call symptoms associated with lymphomas, and particularly CLL, B symptoms, B as in boy. These B symptoms are things like fevers, night sweats, weight loss, enlarging lymph nodes, and sometimes we actually think of extreme fatigue as being related to lymphomas.
Last question. What are the treatment options for people living with CLL?
So the good news about, if there is any good news about getting diagnosed with something like CLL, it's that we are in an era of unprecedented approvals and new breakthrough therapies for treatments. CLL not too long ago was typically treated with chemoimmunotherapy. In the past 10 to 15 years, there have been countless new approvals for not just chemotherapies, but new immunotherapies, targeted agents, and new cellular therapies.
This has been a lot to take in, but I feel like I have a much better handle on the disease now. And thank you for your help. I look forward to hearing about the CLL patient journey.
Of course, we can talk again really soon.